Are you curious about depression? Do you want to understand more what it really is about? Do you understand seasonal affective disorder? Many people don't get that. It's a bit of a new concept as well as in the treatment options available today. We're going to do a deep dive and compare what is seasonal affective disorder and what is depression. What are the treatment options in each of these areas? And what are the counseling and psychotherapy methods and treatment options? And we're going to look at non-mainstream treatment methods as well, including culture and other traditions. Good day, Dr. Joseph Randolph Bowers here. This talk is inspired by questions that have come to us by people in the community and family members. This talk goes out to my nephew, Kyle, back in Canada, in Nova Scotia. They are dealing with the long-winded winter in Canada, as is typical this time of year. February is a bit of a drag. I know because I grew up in Canada and moved to Australia. This is a two-part series. We're going to do a deep dive in all of these questions, so I hope you'll stick with me to the end. The next video does an even deeper dive into cultural and non-mainstream methods that work with seasonal affective disorder and depression. How do we assess seasonal affective disorder? Well, one of the ways is through the diagnostic criteria that's found in the Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5. The DSM-5 suggests that a person would have depressive symptoms during specific seasons, such as fall and winter, and that the symptoms would resolve during the other seasons of the year, and that they would have these symptoms for at least 2 years consecutively. The clinical interview that would be involved would be a thorough evaluation to assess an individual's history and symptoms, and it would look at the onset of symptoms, their duration, what the severity is, and the seasonal pattern that's involved in those symptoms. The interviewer may inquire about specific depressive symptoms, what they feel like, what they look like, what they experience through those episodes, as well as any factors that may exacerbate the symptoms or other ways that would alleviate the symptoms that the individual has tried. The symptoms assessment is also very important, and this would include tools such as the Seasonal Pattern Assessment Questionnaire, or the SPAQ, or the Structured Interview Guide for the Hamilton Depression Rating Scale Seasonal Affective Disorder version, which may be useful to assess the severity and the seasonal pattern of depressive symptoms. The clinician would engage in some level of a physical examination, particularly if they're a general practitioner or a medical doctor. The physical examination may include ruling out any other underlying possible medical conditions, and this is why it's important to see your medical or family doctor. These would include factors that might contribute to the person's symptoms, but that they might not think of readily. This would include evaluation of thyroid function. Vitamin D levels are very important to look at, and other relevant laboratory testing would be important to think about. A psychological assessment may involve screening for other mood disorders, such as major depressive disorder or bipolar disorder. Again, these are different symptomatologies, and they have different treatment options as well associated with each of these. These may co-occur, so it's important to rule out one from the other and to clarify what an individual is dealing with. Assessment may also include evaluating psychological factors like stress, anxiety, coping mechanisms, social engagement, relationships, family life, environmental factors. Also, we would need to assess the sunlight exposure history. This assessment looks specifically at the sunlight exposure history of the individual, which is important in determining the degree of light exposure that the person receives and whether it correlates with the onset and severity of symptoms. And often you can see quite a distinct parallel between these factors and the onset of symptoms. This may involve asking about geographic location, indoor versus outdoor activities and hours through the day, and use of artificial light sources and whether or not these assist or how they might be involved in the individual's lifestyle. Seasonal pattern monitoring is another consideration where we look at monitoring the symptoms over time and tracking the seasonal patterns as they evolve. And this is a situation where the therapist works with the individual over a period of time. This could involve gaining valuable information for assessing the presence and severity of seasonal affective disorder. Keeping a daily mood and an activity diary are highly recommended. And whether or not you're seeing a practitioner, I also very much recommend this for your self-awareness as well in dealing with these challenges in lifestyle and personal growth and development. Using self-report measures could help you to look at your own mood cycles and your own mental health and to help yourself as you go through these experiences. This can help individuals and clinicians to track the changes that are happening in symptoms over different seasons of the year. A collaborative approach is really quite useful to consider as well. When we reframe our involvement with clinicians as individuals seeking help and assistance, and we take a more collaborative approach, we can work at things more collegially, in a sense, more on an equal footing. And this diffuses some of the specialist versus client dynamic and can allow clients to feel more empowered while engaging the expertise of the clinician as a consultant is a really dynamic, more person-centered approach to care. Collaborative methods also have a great deal to offer when we're looking at mental health professionals working with primary care providers such as doctors, family doctors, or specialists within the medical field, psychiatrists included, and other relevant mental health care professionals. This interdisciplinary approach provides a quite comprehensive assessment possibility and also a more dynamic treatment planning approach that could engage an individual's lifestyle as well as their particular mental health condition or issues that they are dealing with at the present time. Having this more lifestyle medicine approach to care can provide a much more holistic approach to seasonal affective disorder and to depression, as we'll explore as we continue in our discussion. So overall then, the assessment of seasonal affective disorder involves quite a comprehensive evaluation of symptoms, seasonal patterns, and contributing factors. The psychosocial context is also very important to look at, and this informs our diagnostic and treatment planning. Early identification and intervention are often crucial for helping to manage the symptoms and for improving the quality of life of individuals affected by seasonal affective disorder. But having said that, I would have to say that intervention at any time in the cycle is really a useful consideration. If you're dealing with these issues, or someone you know or someone you love is dealing with these issues, you want to see help when you can. So opening yourself up to that can be a difficult process. And certainly watching videos like this on YouTube and on other areas, learning from Google searches, to read blog posts and information from relevant and medical and psychiatric and psychological and or counseling kind of websites is a very useful exercise to do and can give you a tremendous amount of information and insights. But again, we do suggest that you see a practitioner and get the help that you need, and or encourage your loved one, your family member, or your friend or acquaintance who might be dealing with these issues to seek help. There's nothing shameful in any of that. And seeking help for our mind and our well-being and our emotions is just as important as any other area that we seek help or expertise for in our lives generally. If our cars are having trouble, we don't have a problem going to see a mechanic necessarily, do we? If our house is having difficulties and we've got a leaky roof, we're certainly going to get in touch with a carpenter or a roofing specialist, right? Well, when this roof is having trouble, we need to go to somebody who can help us with this roof, the roof that's on our shoulders, and help us to sort out what's going on up in the attic a little bit. And this is a good thing. So let's look at depression. Depression is a complex and multifaceted mental health condition that can manifest in various ways, and it can affect individuals quite dramatically, emotionally, physically, and spiritually. While the specific symptoms and experiences of depression can vary from person to person, there are common features that characterize the existential nature of depression. Before we go into these, I just wanted to explore just a little bit what existential means. The word existential refers to matters that relate to existence, particularly in the context of a philosophical or meaning-layered inquiry into the nature of human experience, human existence, a person's sense of meaning, their place in life, how they feel about themselves, the individual's experience of being in their world. Existentialism as a field in philosophy emerged during the 19th and the 20th centuries, primarily in Europe, and particularly after the World Wars, when the exploration of issues of meaning and philosophical considerations following the enormous, huge suffering after the World Wars triggered a great deal of meaningful social, philosophical, and political reflection. These developed fundamental questions and insights about the nature of being human, the nature of meaning and purpose, the significance of our life and our very existence, and what does this mean? In the context of mental health and psychology, then, the existential movements or themes translated into looking at people's subjective experiences and their concerns in everyday life, their sense of evaluating their own experience and their own lifestyle considerations. Individuals would grapple with their own questions of meaning, existence, identity, freedom, responsibility, and the search for meaning and purpose in their lives. Existential perspectives emerged in a quite unique and deeply and profound way regarding personal natures and human experiences, and these were emphasizing the importance of confronting the existential questions, the deepest, most pervasive questions of life, and finding ways to live more authentically, more truthfully, and more with mindfulness in life, and in facing life's most inherent uncertainties and challenges. In the context of depression, then, and seasonal affective disorder, the existential themes manifest as feelings of existential dread, meaninglessness, alienation, and a sense of disconnection even from oneself and within oneself, disconnection with others, and disconnection from the world around us. Individuals experiencing these profound and deep and quite pervasive and enduring sensations of depression may grapple with the deepest existential questions about the purpose of their existence, the nature of suffering, the nature of the search for human meaning, the nature of our emotional pain and our despair. And what is this all about? And why are we dealing with this profound suffering? Addressing existential concerns in therapy and counseling within the Western approaches helps individuals to explore and to make sense of their existential, deeper experiences and values and beliefs and questions around these issues. This may involve engaging philosophical discussions, but therapy in the main explores our making meaning as a generative and an experiential process where we seek to go through a depression and learn from depression and allow depression and or seasonal affective conditions to, in a way, become our teachers, to help us, to give us insights, to help us to move forward with issues and concerns that would give us a new direction in life, or at least a sense of resolution and of peacefulness in the moment. Sometimes life is more about accepting what we have now rather than seeking for change, accepting where we're at now rather than always wanting to move forward, accepting and embracing our reality rather than seeking to engage with personal growth at the moment. Sometimes in depressive or seasonal affective states that we find ourselves in, we don't have the strength to think about moving forward. We simply need to be present to where we are right now, and that can be enough for where we are in this moment. I think this is a very important aspect of the lessons that we learn within these states of being. By integrating the existential perspectives into therapy, people can develop a deeper understanding of themselves and their place in the world, leading to a greater sense of self-awareness, a resilience and inner strength, and a growth in personal qualities and dimensions. Understanding depression is one of the most central things in our human existence, I believe, that is something that you're terribly blessed not to ever experience, but most of us seem to go through bouts of depression from time to time, and it certainly has been part of my life. And I think that within the depressed state, we can gain a lot of deeper awareness of ourselves as people and what life really means. And this exploration is really deeply personal, and it's difficult to articulate. And often when we're in the state of depression, we need to simply go through it, to live through it, to survive it. And afterwards, we often find a lot of insights emerge as we reflect back on the depressive experience. This is an important insight because it's important for us to maintain a sense that even if we have no feeling of hope or of even inner resilience right now in this moment, that the future is about the turning of the corner that's just in front of us. We don't know when that's going to happen, but it will happen, and it always seems to happen. That depression can sometimes be chronic and go on for a very long time, but that there is light at the end of the tunnel, so to speak, and that there is hope, because hope is a constituent element within our DNA. Hope is part of the evolutionary process. And I personally, truly, deeply believe through my own experience and through journeying through depression with countless individuals over the years, that depression itself and seasonal affective disorder have an inherent wisdom. They have layers of teachings and of insight that they provide for us when we're open to that. And sometimes it can take another person to walk alongside or to hold our hand or to simply be there for us while we're going through this. And this enables that insight to sort of percolate through this darkness of depression. So looking at the symptomatology of depression then, we know that there are persistent sadness and feelings of emptiness involved in the state of depression, and generally individuals with depression often experience a pervasive sense of sadness and emotional numbness disconnection from the self and from others. And this persists over a fair amount of time. The feelings of emptiness can be difficult to shake, even in the presence of positive influences and events and experiences in daily life. A great deal of effort can go into supporting an individual with depression, and can often seem fruitless in the sense that nothing budges the state of depression because it's become pervasive and part of the individual's makeup in the moment. And we emphasize in the moment. Loss of interest or pleasure in activities is common in depressive states. This can lead to a lack of motivation and enjoyment in activities of daily life that are pleasurable and otherwise meaningful activities. Hobbies, social interaction, intimacy, sex, other sources of joy and pleasure and involvement in life can no longer hold the same appeal and can become dry and stale and dull for an individual in the state of depression. In this state, it's fairly common to enter into an experience of hopelessness or of despair. Existential anguish is another way to express this state of being. This is a sense of pervasive hopelessness about the future, and where feelings of despair seem to be heavy and quite common and almost all of the time. Individuals may struggle to envision a way out of their emotional pain or to see a future worth living. And this is a dramatic challenge to the nature of human existence. In fact, depression cuts to the very heart of our reason for living. And while this question is so important and profound to actually address and to think about, it's also on the edge of despair. And when we're in this space, it's good to walk carefully, to walk gently. When we're walking in a field of flowers, we're careful where we walk because we don't want to step on the flowers. We jostle our feet back and forth between the plants to try to save as many flowers as we can. I've watched an individual with deep and profound depression walk through a field of flowers in the park. And they did this themselves instinctually. They walked in such a way that they preserved the flowers. They tried not to walk on the flowers. As I observed this, I was astonished because they were so deeply in despair, and yet they had this innate sense within their body-mind to be careful, to be loving, to be considerate, to be kind. I asked them afterwards, did you realize that when you walked through the field, you jostled your feet back and forth between the flowers so as not to crush the little flowers? They looked at me, puzzled. They said, I wasn't aware of that at all. I said, maybe we could go back to the field and take a look at where we walked. And maybe you could walk there just a little bit to the edge of the field and see that pathway that you trod through the flowers. We went back to the field. The individual was so overwhelmed. They began to get teary-eyed and began to weep. And they realized that within them was an innate wisdom, a strength that they didn't know existed, that enabled them to express care and compassion for the little flowers of the field. I was personally reminded of St. Francis of Assisi, who also experienced the depth of existential despair when the weight of human suffering was upon his shoulders, and he realized the enormity of the darkness of human fragility and pain and despair. Francis also cared for the flowers of the field. He found that this innate wisdom that exists within us is simply part of our nature. And when we become aware of this, it cracks the husk of our awareness in such a way that allows us to get beyond our ego identity within depression to a new place of deeper existential appreciation. And in this space, within the egg of our identity that is now cracked open, allowing the ego to breathe, we realize there is more to life than how I feel. I am not so much how I feel. I am more than this body. I am more than what I feel. I am compassion. I am consideration. I am kindness. These qualities of my being are so pervasive within us, they form the foundation of our existential existence, our very sense of being human, of being alive, as being part of this planet, a creature that is part of Mother Earth. This awareness is a much deeper sense of non-identification with our feelings, of finding an objective place where we can stand at the edge of the field of flowers and realize, I would not walk through a field of flowers to crush those beautiful little flowers. There is part of me that would preserve life. There is part of me that would preserve hope, not because I feel hope, but because hope is more than a feeling. Because hope is part of the structure of my DNA. It is part of the fabric of my breath, of my very breathing. I don't need to feel it. I simply need to be it. And this is one of the most profound insights that we could have when it is to learn about and awaken within this state of depression. Hopelessness and despair can also involve cognitive symptoms at that more egoic level where we're looking at our functioning in mind and mindfulness. Negative thinking patterns are dominant within the depressive state. The person with depression often feels distorted thinking and patterns that are characterized by self-criticism, pessimism, and a focus on perceived failures and shortcomings. This is so common, and individuals will engage in this obsessively in the negative thinking and feeling cycles that build on each other and become like the dark clouds that build storms within our being. This struggle engages the individual with a sense of blindness where they can't see beyond their own nose, where they can't see a situation where even light is a possibility. In the depressive state, it's difficult to concentrate or to make decisions. A very wise friend of mine many years ago once told me that when in this kind of state of emotional turmoil, it's best not to make major decisions in life. Postpone decisions and just kind of cruise and deal with the day-to-day and just simplify things in a dramatic way that enables us to just get through and deal with what we need to deal with in the moment. And this is a very wise counsel. Depressive symptoms involve cognitive impairment, where it is common in depression that difficulty with concentration, memory, and decision-making is really quite pervasive. The individual will feel mentally foggy and will slow down their cognition in quite a dramatic way, making it challenging to complete tasks or to engage in any complex thinking. Physical symptoms are also involved quite dramatically in the depressive state, where there is fatigue, chronic fatigue, and low energy. Depression can drain individuals of their energy and vitality, leading to persistent feelings of fatigue and lethargy. Even simple tasks like doing the dishes or just cleaning house will feel quite exhausting and will probably be neglected during times of depression. Individuals will struggle to find any motivation to get out of bed even in the morning. And this can be a very common experience. Changes in appetite and weight are also common with depression, and it can go either way. Depression can affect appetite and eating habits and lead to either significant weight loss or significant weight gain. We need to have also a sense of compassion with ourselves and with our bodies in these times. Some individuals will experience changes in their appetite, while others may lose interest in food altogether. Sleep disturbances are also quite common. Sleep problems are common in depression, and with individuals experiencing difficulties falling asleep, staying asleep, and waking up too early in the morning, or waking up through the night and not being able to get back to sleep. Insomnia or hypersomnia, or that is excessive sleepiness, can exacerbate the feelings of fatigue and contribute to overall distress and anxiety as well. Often anxiety goes along with depression because depression is so structurally challenging in the sense that it has a pervasive quality across the dimensions of our existence. When we're depressed, it affects everything. And so this can contribute to increasing levels of anxiety as part of our mind or our emotional self becomes aware that our depression is compromising our capability to function and maybe compromising our ability to be involved in activities of daily life and contributing to our relationships or even functioning with work or with other responsibilities within our life. And this can generate a very negative cycle between depression and anxiety where we push ourselves continually and don't give ourselves necessarily the time that we need to rest. The existential nature of depression then involves a loss of meaning and purpose, and depression can involve a profound sense of despair, as we've discussed, characterized by feelings of meaninglessness and lack of purpose in life. Individuals may question the value of their very existence. Alienation and disconnection can lead a person with depression to feelings of disconnection with themselves, and this is really a profound experience. Individuals can feel disconnected from their emotions, their sense of self, their relationship with others, and this can lead to even more isolation and loneliness. Existential dread and mortality awareness are also part of the depressive cycle, where it's a heightened awareness of mortality and suffering and of the very nature of the human condition, which involves suffering, and it certainly does, and it's true. Individuals will grapple with this and with the very nature of life and of death and the search for meaning and the inevitability of suffering. Overall, depression is a deeply personal and subjective experience, and it encompasses and embraces a very wide range of emotional, cognitive, and physical symptoms. Its existential nature is quite profound and impacts on every area of life. Understanding and addressing the nature of depression and the dimensions that depression manifests within each person is really an important aspect of learning and of growing in a holistic application, a holistic support that is person-centered, and in this way holistic and naturalized to your own circumstances so that we can work with and deal with the debilitating components of depression, but also at the same time build in an awareness that even within this, we are learning coping strategies. Even within the depth and profoundness of this very struggle, we are actually working hard to maintain our existence, to keep going, and to learn from that in an experiential way is totally different from reading about it or from even talking about it in therapy, because there is nothing like going through it. There's nothing like living through this. You kind of have to be there. Once you're there, once you've experienced it, the book information and all of this knowledge that I'm sharing with you isn't really the most important part at all. The most important part is living through this experience and gaining a sense of, well, I've been there. I've done that. I know what this is like. This is how I cope. This is how I deal with this. And this is probably different from how you deal with this. And that's okay. And from that emerges just a teeny tiny bit, a tinge of wisdom. Wisdom, emerges through the hard yards in life. Wisdom comes from the difficulty of experience. Wisdom emerges from the existential experience of living through depression. We can't go around it. We can't circumvent it. We can't get rid of it, really. We have to experience it. We have to deal with it. We have to face it. And this means that we will gain skills. We are learning skills. We are gaining little bits of wisdom each day. Let this be an aspect of insight that helps, an aspect of wisdom and of, how can I say, maybe even that hope that I was talking about earlier, of the flowers in the field and how vital they are to our very existence. So as we compare seasonal affective disorder and depression, we realize that seasonal affective disorder manifests during particular seasons where depression is a pervasive experience that can happen at any time. Seasonal affective disorder can become waning or can diminish as the darker seasons of the year diminish, where depression may not have a correlation to the seasons, although it certainly can become a bit more difficult during the winter seasons. The experience of seasonal affective disorder can sometimes be really quite profound and deep and pervasive. And an individual with SAD may have the luxury of being kind of aware at some level that it will end as the season dissipates, where this isn't the case for an individual with depression necessarily. Depression will also go on its own journey in the sense it will have its own cycles and patterns, and this varies from individual to individual and condition to condition. Depression, for example, could last between 2 to 6 months and dissipate. Depression could last over a period of 12 months or a couple of years. Sometimes depression becomes so debilitating an individual would seek to take a medication to assist with lightening that depression load just enough so that they can cope. The same is true with seasonal affective disorder in that medications can also be assistive with the condition. Diagnosis of each of the conditions is based on different criteria within the diagnostic and statistical manuals, and also different diagnostic tools are used to look at and assess SAD versus depression, generalized depression. Next, we'll talk about the etiology of SAD and of depression. Etiology is the study of, the exploration of various conditions or phenomena, such that we look at their origins, how they manifest, and what could be done about them. The etiology then of seasonal affective disorder examines the reduced light exposure of an individual as happening during the fall and winter parts of, and that this has a effect of increasing the experience of depressive symptoms. And this manifests for the changes in daylight hours which disrupts the circadian rhythms of the individual. And this affects the neurotransmitter levels, and particularly the serotonin and the melatonin within the mind, within the brain, which regulate the mood and the sleep cycles. The biological factors that are involved in the etiology of SAD include genetic predisposition, possibly, of an individual towards the differences in the circadian rhythms as they manifest through the seasonal patterns. And this can involve sensitivity, that is a genetic predisposition towards being light sensitive, which may contribute to a susceptibility towards having seasonal affective disorder. Other psychological factors are also involved in the etiology of SAD. This could involve a vulnerability to stress and anxiety, seasonal changes in routine and social activities, and psychosocial factors that may exacerbate the symptoms of seasonal affective disorder as well. With depression, the etiology looks at the biological factors again. Depression is associated with abnormalities in neurotransmitter functions, and this particularly involves the serotonin, the norepinephrine, and the dopamine levels within the brain, which regulate mood, pleasure, and motivation. Genetic factors may also predispose individuals towards this change of the chemical makeup of the brain. And there are, of course, the psychological factors that are studied and examined within the depressive state. These involve stressful events, trauma, loss, grief. Interpersonal conflicts can also contribute and lead to the onset or the worsening of states of depression. Negative thinking patterns are also involved. Low self-esteem and maladaptive coping strategies may also play a role. Environmental factors can involve social, cultural, and environmental issues such as socioeconomic status, access to health care, social support networks, and these can influence the onset, course, and severity of depression. All of these factors are quite complex, and a lot of these factors are outside of individuals' choice and control. We don't choose to have maladaptive coping strategies. We don't choose to have interpersonal conflicts necessarily. We certainly don't choose traumatic life events and stressful experiences and loss and grief. These things are usually thrust upon us, and if our coping mechanisms are low at the moment and we are predisposed to depression, then these factors have a great deal to play in pushing us towards that weight of the world on our shoulders, quite literally and figuratively. The social, cultural, and environmental factors are way beyond most of our individual sense of control. Our having healthcare issues, disabilities, or other mental health concerns are also largely beyond our control. We can certainly make differences in the ways that we learn to cope with these things over time, the ways that we learn to grow through these experiences, but this is an ongoing process, and it often requires the help of other people in our lives, of carers, of partners, of our friends, of therapists or doctors or clinicians of some kind who walk with us and help us to learn strategies to deal with these very enormous challenges. In regards to the etiology of seasonal affective disorder and depression, there is quite a range of symptomatology and a very different sort of assessment criteria that enables us to understand the nature of and origins of each of these conditions, and also of what the treatment options may be in each case. But like we have said many times, the main consideration for me in my work as a therapist is, how do I apply this in the life of my client? How do I encourage the client to apply this in their life? How do their understanding help them to cope in their situation? How do the experiences and stories of other people help the individual to learn and to grow? These are all really important and vital considerations that enable us to grow through the experiences of dealing with these challenging conditions and finding ways forward in life. Now, let's discuss some of the treatment options related to seasonal affective disorder and depression. Seasonal affective disorder, first off, involves light therapy or phototherapy. Exposure to bright and artificial light is typically using like a light box that emits a full spectrum light. And this is a common treatment for seasonal affective disorder. I remember the first time I heard about this treatment, I was really quite skeptical. This was, admittedly, several years back, before there was a lot of research in this particular area and treatment modality. And I did look in the literature at the time, and I did not find all that much evidence, but I did find some articles that were helpful. That encouraged me to try out this therapy. And one of the ways that I often learn about therapeutic methods is I try them to learn about how these processes work, what's involved, what it feels like, what it's like, getting different products and working through it and trying it out. And I've tried this in many different issues in many different circumstances, and even if I don't have the particular problem or area myself, I'll often explore it in some of these ways if I can. And this gives me a direct experience and a direct awareness. And this increases my compassion. The compassion level is very important for me as a therapist, in the sense that if I can experience what it's like, then I'll have a deeper awareness of what it might be like for my client. And, I never can assume that I know what someone else is going through. But if I've been through some of that myself, I at least know, and I've been there as well. And I can journey with the individual through their exploring what their experience is like with a much more compassionate and realistic perspective. Light therapy is thought to help regulate the circadian rhythms and the neurotransmitter levels. This alleviates the depressive symptoms. It's really quite interesting. The light literally affects the chemicals in our brain. When we wake up later in the day, as the season of fall moves through into the season of winter, we wake up a bit later every day. This lack of sunlight has its impact on the mind. So I got myself a light therapy lamp and I turned it on during that midsection of autumn or fall, and I used it consistently and into the winter, and I really did find that it helped. It helped to alleviate the symptoms of depression in the middle of the winter. I have to say that the middle of the winter, as a Canadian, has always been a time of reflection, a time of going inward, a time when I would naturally also feel a sense of connection with my ancestors, with our history, and with the power of the land as it slept through the winter, as the trees were heavy laden with snow, and as the animals nestled in to their winter harbors. I would nestle myself around the fire, and I would find myself drawn to winter crafts like crochet and art and painting, and engaging with discussions and telling stories with family members around the fireplace and around the kitchen table. These times through the winter of sharing a cuppa and sitting and telling stories were always really important and part of cultural background and upbringing. And the appreciation and spirituality of winter then overlapped with this experience of a personal sense of depression. What I found, though, was that as I got older, the seasonal depression through the winter would be more debilitating because, in one sense, as an adult, my responsibilities were so much more and more prevalent, And with that sense of responsibilities, I couldn't sort of relax as much as I could in my younger years. I couldn't engage in winter activities as much as I might have liked. I found the pressure to perform and to continue in my responsibilities as an adult very difficult to manage as I got older. And so those depressive cycles were more difficult to deal with. And I realized that I had to reach out for help to deal with this as an adult. And this is often true, that the kind of mental health patterns we might instinctively or genetically be predisposed to having in our youth, young adult life, in our 20s, may be harder to deal with in our 30s and 40s when we have our children, when we have our jobs, when we have our adult responsibilities, when we have many, many tasks that we have to deal with in day-to-day life, and where our expectations on ourselves are much higher. We can't function in the same ways, and we may need to reach out for a mental health assistance or a medical assistance to deal with some of these challenges. And it's good to realize this. Seasonal affective disorder has this layer of challenging people to cope during certain times of the year to maintain their level of performance and participation in life and activities. The cognitive behavioral aspect of psychotherapy within the treatment of seasonal affective disorder can also be quite helpful and useful, because psychotherapy counseling helps us to learn coping strategies and to bring to our conscious awareness what might be less conscious, to bring to our awareness ways that we are feeling depressed and the ways that we can cope with that and learn new ways to cope with that. Engaging in regular physical activities is also a really important aspect. So we look at lifestyle changes with seasonal affective disorder. We look at managing a healthy diet. Just think about a Mediterranean diet. Look that up if you haven't already. Mediterranean diet is a well-balanced approach that can assist for a wide range of areas. Managing stress is also very important. Practicing good sleep hygiene, getting to bed earlier, having a slow down time, and not taking the digital products or handheld devices into the bedroom, keeping them out of the bedroom if at all possible, and giving ourselves some time to come down to earth, to settle ourselves, to have maybe a herbal cup of tea or some beverage that settles us in the evening and in that hour or so before bed. And also to be aware of our vitamin supplementation. Vitamin D is really important in regards to seasonal affective disorder and depression. So we can also get our vitamin D levels and blood levels for other vitamins and minerals checked through our general practitioner or family doctor. The psychological factors there are all relevant. The health and lifestyle factors, all relevant and important in dealing with seasonal affective disorder. Treatment options for depression involve quite a number of areas, and so we'll begin with counseling and psychotherapy. Various forms of psychotherapy are quite helpful with depression, and these include cognitive behavioral therapy, or CBT, and interpersonal therapy, and this is looking at our relationships and our relational skills and how we can improve this, can have an influence on how we deal with depression from day to day. Psychodynamic approaches in therapy are quite helpful. For example, I engage with neuro-linguistic psychotherapy and with hypnotherapy, and I've found these quite helpful and useful within cases of working with depression. These are also quite effective in terms of looking at lifestyle considerations and taking therapy outside of the office into walking therapy or therapy in nature or therapy out in the public park. These types of therapies engage our environmental relationships and awareness. Therapy involving a gentle approach to gardening can also be really quite helpful with depression. These therapies can help individuals to identify and to challenge negative thought patterns and approaches to their own way of thinking, to their cognitive skills, and improving these and addressing the underlying emotional issues or concerns that come up during the depressive cycles. There often will be a cyclical nature to these cycles, and we can become personally very exhausted by these cycles because they're often really quite repetitive. And we get used to our own way of thinking, and we realize, or a part of us can twig to the fact that, oh my God, here I go again, and I can't seem to stop it. This is where an aspect of mindfulness practice and meditation can also assist with depression, because when we can concentrate on our breath and allow the thoughts to come and go like the clouds in the sky, we can allow the feelings to come and go. We can allow the feelings of depression to be there and to find a different focus, to detach in a sense from the feeling and the existential experience to a deeper place or just a different place related to simply our breath or to concentrating on another part of our life or another location within our environment. Someone taught me in the past to just look at a part of the wall and just to look at that part of the wall and then to breathe slowly and to think, I am more than my thoughts. I am more than my feeling. I am more than my thoughts. I am more than my feeling. Looking and staring at that part of the wall and going, I am more than this. And sitting with that is really quite profound. It brings up quite a realization that the feelings and the experience of depression can be whatever it is. And I can allow that. I can learn to form a different kind of relationship with whatever I'm going through by finding a different place within my mind, within my body, that is aware of that, but not so enmeshed in it, not so involved with it, not so overwhelmed by it. And when we can form that just tad bit of detachment, of having a different experience within the experience, this can form a gradient. I'm not saying a dramatic change. I'm talking about a difference between, say, being at a 10 at the worst on the scale of 1 to 10, at the absolute worst, to being maybe a 9.6 or a 9.7 or a 9.8. That 0.1 or 0.2% of coming down from a full-blown 10 is a significant change, because it is a change that could make a dramatic change eventually. It's the smallest change that often makes the most difference, is a key principle in psychotherapy, a key principle in therapeutic methods. The smallest change often makes the most difference. But the trick there, the key, the magic, is finding that change. It's finding what change makes the most difference. The struggle that most therapists and clients have is they circle around the same problems all the time and talk about the story and rehash everything. This just doesn't work. The key in true psychotherapeutic change work is finding the least change, the least difference that makes the most change, the most difference. Finding that little element that creates the shift, that opens up the possibility of change. This is the real magic of psychotherapy with seasonal affective disorder and with depression. Depression also involves the use of medications, of course. Antidepressant medications are commonly used nowadays. Selective serotonin reuptake, like I've mentioned, the smallest change makes the most difference. The chemical shift of these neurotransmitters in the brain is a micro change, definitely, but it can make a dramatic difference from lifting a depression or reducing a depression from, say, a 10 on the scale down to maybe a 7 or an 8, or even down to a 5 or a 6, so that an individual feels that they can cope in daily activities, and the medication reduces the depression to that place where they can cope, and where, I might add, psychotherapy becomes much more effective in unison with the medication. So you're then bringing together micro changes that make the most difference. And the key here is that using more than medication is important. Using more than psychotherapy is sometimes important. It's creating multiple options or multiple ways of creating small changes that add up to significant change in the end. And this is part of how we work with these complex conditions. Also, we have tricyclic antidepressants, and we have monoamine oxidase inhibitors. These are commonly prescribed for depression. These medications work to increase the levels of the neurotransmitters in the brain that regulate our mood. So we have also electroconvulsive therapy, or ECT, which is also a standardized treatment for quite severe and pervasive and prolonged depression, treatment-resistant depression. This procedure involves the administration of electrical currents to the brain that induce controlled seizures, which help to alleviate the symptoms of depression in certain individuals. Transcranial magnetic stimulation is also used in certain cases, and this is a non-invasive procedure that uses magnetic fields to stimulate nerve cells in the brain. It is typically used for individuals who have not responded to antidepressant medications. And next we have lifestyle changes, which we have mentioned before, and these are similar to seasonal affective disorder, where the lifestyle changes involve regular exercise, healthy diet, stress management, adequate sleep, and these play crucial roles in helping to manage depression. Comparing the treatments then, both SAD and depression have been treated quite commonly with psychotherapy, medications, and lifestyle changes for sure. These approaches aim to alleviate symptoms and improve functioning and enhance overall well-being. Unique treatments involved with SAD include the light therapy, which isn't used really in depression treatment necessarily. The light treatment is, of course, targeting the circadian rhythms effect that the seasonal affective changes have in an individual's brain with the seasonal affective disorder. Conversely, treatments such as electroconvulsive therapy and transcranial magnetic stimulation are more commonly used for severe and treatment-resistant depression and are not used with SAD. Medical or medicalized differences involve the fact that antidepressant medications are commonly used for both SAD and depression, and specific medications and dosages may vary based on an individual's factors, the symptom severity, and the treatment response. So obviously the medication and prescription of the medication is a unique evaluation by the medical practitioner. Seasonal considerations, of course, are different in each of these conditions. Treatment for SAD may be tailored to address the seasonal patterns and symptoms, of course, with the interventions emphasizing light therapy and similar treatments, perhaps getting outdoors more often through the winter seasons. And in contrast, the treatment for depression is not really so much tied to a specific season necessarily, although the awareness of seasonal fluctuations are interesting to consider and are worthwhile to explore with a person who has a pervasive long-term depression, because I have noticed over time that cases with long-term depression do fluctuate over time and can get worse through the winter months. So there can be overlaps of seasonal considerations within generalized depression. Overall, while these similarities and differences exist between SAD and depression, there's also really important things that we can learn from each of these conditions. They shed light on each other in various unique and quite interesting ways. Consulting with a healthcare provider is really useful, and a mental health professional is essential for developing an individualized treatment plan that's tailored to your needs or to the needs of the individual suffering from these conditions. This is a really important aspect, but also to personalize, that is, to tailor the intervention to the specific circumstances of an individual, to their life, their lifestyle, their diet, their capacities for engagement and activities, and their sense of themselves and their identity, their culture, their values, and also their spirituality are really important aspects and layers to coming to terms with a treatment plan in each case. While considering counseling and psychotherapy for both seasonal affective disorder and for depression, I just wanted to add a few qualitative layers to enrich the discussion and take things a little bit further and do a little deep dive into the use of counseling and psychotherapy methods with these conditions. I think that we've said a lot already about seasonal affective disorder and the use of light or phototherapy. And these are useful in the context of counseling and psychotherapy, but the use of the light therapy, I say, is an adjunct to the other methods within the therapy. So it's not one or the other, but usually with these conditions, because they're complex, we look at both, and we look at contributing different approaches that add to a person's resilience and ability to cope, and of working with the condition in various ways that build in the healing modality and environment that enables advancement of a solution for the individual over time. And it does take some time. Cognitive behavioral therapy is a dominant treatment approach, of course, but often we find that CBT is modified in many ways by every practitioner that uses CBT. CBT is highly effective in terms of the research literature, but often CBT is modified by being combined with other approaches and methods in counseling and psychotherapy. CBT helps, I think, to identify the challenging behaviors and thought patterns, negative thought patterns and beliefs that contribute to depressive symptoms. And CBT helps individuals to develop more adaptive ways of thinking and coping with stressors, as well as implementing new behavioral strategies and methods to increase our activity levels or to engage in enjoyable activities. CBT can challenge our belief systems and enable us to find new ways of believing, new ways of feeling, and of values that can move things more forward in our lives, be more generative. Wouldn't it be useful for us to think in more practical ways or more useful ways to actually change the way that we think about things, to make that thinking itself more effective, to work with our minds for a change, to develop the change that we're looking for. And this is a type of skill and self-awareness that people learn or can learn within an experiential approach to therapy. I find that balancing CBT with looking at the feelings and behaviors at deeper levels, at that existential sense of things, gets to the why and the how do I do these things. And when we get to these deeper sense of awareness, we go into our motivations. When we tap into our motivational levels of why and how we do what we do in life, we uncover the underlying emotional issues that promote insight and self-awareness and possibly resolution of long-standing patterns. And getting at those patterns and creating change in those patterns is part of that psychodynamic work that can be done in therapy that frees up a lot of emotional energy that's stored within our bodies and inside our minds in such a way that it can contribute to our depressive states. When we free up that energy, it frees up the depression to resolve itself over time more readily and more easily. Medication management, I think, is also an important adjunct to counseling and psychotherapy. And I think that, again, the key insight to take away here is both and. Medication with psychotherapy is optimal. All of the research tends to indicate this. Psychotherapy with medication is also optimal where that is necessary. Individuals who are on medication possibly wean themselves off of medication if that's what they want to do. And that is helpful as it gives a clear indication of what the individual's functional baseline is in their behavior and their day-to-day ability to cope without the medication as a baseline. Understanding that baseline enables to see what is the relationship that the medication has to their lifestyle behavior and to their overall functioning, their psychology, their emotional states, their resilience, their ability to cope in their relationships, their work life, and their overall lifestyle. And having this sense of baselines is an important consideration from the perspective of psychotherapy. We often don't have the luxury of seeing that baseline, however, because many of the clients that we work with are on medications in a long-term capacity. And in those cases, we work with the individuals while they're on their medication, and we assist them to develop skills and capacities and coping mechanisms that enable them to grow in their sense of strength and personal empowerment. The dominant methods in counseling and psychotherapy, as well as medicalized approaches to the treatment of seasonal affective disorder and depression, involve a range of strategies and combine a number of evidence-based methods. And evidence-based is an important concept in mainstream approaches to these treatment modalities because the evidence is there in the scientific literature. It's what mainstream practitioners rely on the most to gather our resources and to gather our treatment methods to enable us to work with individuals and the specific issues that come up when we're dealing with seasonal affective disorder and with depression. Evidence-based approaches address the specific symptomatology and the underlying mechanisms of each of these conditions. The treatment decisions that are involved should be made in a collaborative way between an individual and their healthcare provider, taking into account the individual's preferences, their treatment goals, and their response to the interventions. This is a situational and personally relevant, person-centered approach that is vital to our working in all of these areas. And this needs to be respected because these considerations are so important. The key is that the individual will engage with the therapeutic process and that the individual wants this at some level or is at least willing to give it a try. And when we're willing to give it a try and we're willing to have or be open to the conversation, then we're 10 steps ahead of where we are otherwise. And this is the key consideration with any treatment related to these and many other issues and conditions. It's our attitude and our sense of being open, and this is really one of the key considerations that enables us to engage with practitioners and to find a way forward with our issues. Next, we're going to look at non-mainstream treatment options. Non-mainstream treatment options with seasonal affective disorder and depression are quite varied and come from a number of different modalities and professional domains of practice. Allied health therapies are many and varied, and these could involve exercise therapy, regular physical activity such as aerobic exercise, yoga, tai chi, have been shown to improve mood, to reduce stress, and to increase levels of energy and vitality. Exercise therapy may be used as a complementary treatment for seasonal affective disorder and for depression by promoting overall well-being. The social engagements involved in these methods are also quite relevant and important. Sometimes they enable us to get out of the house and to be involved with a group in town or in our community. And this can engage us in social relationships that can help us to work through and deal with our issues. The next area is nutritional therapy. Certain dietary factors, such as omega-3 and vitamin D and folate, for example, will have an influence on mood and mental health. Nutritional therapy and having a dietitian or a registered nutritionist take a look at your situation could be quite useful. Often public hospitals employ these types of practitioners if you're looking for somebody to work with you at this level. Nutritional therapy can involve dietary modification or supplementation to support mental health in individuals with seasonal affective disorder and with depression. Alternative health practices could include acupuncture. Acupuncture is an ancient Chinese healing practice involving the insertion of thin needles into specific points on the body. It's believed to restore the flow of qi, or energy, and to promote balance within the body energy system. Some individuals with SAD and with depression may find acupuncture helpful for reducing symptoms and promoting relaxation. Herbal remedies have also been found to be useful. Herbal supplements may sometimes be used as alternative therapies for depression. However, it's essential to use caution with these types of approaches and with herbal remedies, as they can interact with medications and may not be suitable for everyone. Cultural methods are also used quite commonly. Cultural methods in the treatment of SAD and depression are many and varied. Traditional healing practices within cultures are quite important to a number of people. And although in mainstream Western sensibilities we've lost some of the sense of these things, it's still there in our Western dominant cultural mindsets and still surfaces when and if practitioners and clients are open to discussing these types of approaches and methods. For example, in some cultures, traditional healing practices may include a sense of ceremony, but ceremony within traditional cultures and also within Western and mainstream cultures is part of everyday life and part of the seasonal life that we live and part of our daily patterns of waking, sleeping, engaging with life and relationships, birthdays, celebrations, seasonal celebrations, Easter, Christmas, and other events throughout the year, Mother's Day. These are, in a sense, ceremonial practices that we engage in everyday cultural ways. In more traditional cultural practices, ceremony can take on an even more depth of awareness, meaning, and ritual, and storytelling, and a sense of connection to the self with nature and with other people, with our ancestors, with our families of origin, with our cultural heritage, and our connection to country and to the sacred land. these can play a significant role in addressing mental health concerns for individuals that have these values and these ways of working with their personal and psychological experiences of life, and making meaning from those experiences is a cultural process. These cultural methods may be integrated into our treatment approaches for seasonal affective disorder and for depression. And these can have a sense of honoring the individual's own values, beliefs, and attitudes, as well as their cultural experience. Mindfulness and meditation practices are also another layer of cultural experience that has quite a depth, and for people that practice these methods can be quite significant and meaningful to them. Mindfulness-based practices can be rooted in Eastern traditions such as Buddhism and involve cultivating present moment awareness and non-judgmental acceptance. I might add, however, that within Western culture, we may have forgotten that we have a profound heritage related to centering, to mindfulness, prayerfulness, and other types of awareness that center the person within the body, within the moment, and these are part of our Western heritage as well. Within the Eastern traditions, the mindfulness meditations involve yoga and other types of disciplines and practices and contemplative practices that will help individuals to manage stress, regulate emotions, and improve mood. There is a diverse range of approaches and perspectives on all of these issues. And isn't this a good thing? Because we are so individual, all of us, in our various beliefs, attitudes, and values, that we need a diverse portfolio of possibilities and of treatment options. And we don't all want to go and see the same kind of practitioner. We don't even want to go and see the same kind of counselor or general practitioner or family doctor. We need a diversity of approaches that fits the diversity within our humanity. And this is just part of the wonder and the complexity of working with these particular issues of seasonal affective disorder and of depression. The encompassing and wide range of allied health, alternative health, mainstream, and cultural practices reflect this diversity of approaches and of values that people bring to these issues. There is a complementary role there that all of these play, in the sense that treatments may not be considered mainstream, but they may also provide a level of comfort or of insight that enables an individual to deal with enormous challenges in life. And if that's the case, that's an important consideration and needs to be respected. Individualized care is a concept even within medicine and mainstream approaches to counseling and also psychotherapy. Individualized care is to tailor the care to person-centered considerations. This requires guidance and recommendation by the practitioner to an individual that is informed by that individual's life, their values, their background, their beliefs, their culture, their language, their gender, their difference, their sexuality, their capacity in relationships, and their sense of lifestyle and their way of living. All of these things need to be taken into consideration and to be respected. The evidence and safety involved, I think, in all of these methods is a central consideration for all of us, obviously. That some mainstream and non-mainstream treatments may not be optimal for certain individuals because of the risk profile involved in those methods or approaches. This can be equally true with mainstream methods and with alternative methods. It is crucial for every individual, for all of us in our lives, to evaluate critically what we're doing and what we're open to do and what we will actually try to do. before we actually do it, not while we're doing it. This is the way that we make enormous mistakes, and that may lead to the worsening of our health or our conditions. It is crucially important to look at the potential risks, what we call contraindications, for any and every treatment that we consider. Even things as generic as cognitive behavioral therapy, when used in an incorrect way in a particular case, could lead to problems, to problematic ways of thinking, for example, or to conclusions that may not be adaptive to an individual's optimal way of life. Taking all of this into consideration, then, an individual has to make their own personal decisions around safety and around what is appropriate for me. And evaluating this can be difficult. Seek additional advice. And in that way, at least you'll be getting as much information as you possibly can. And do your research. Go on Google, research the area, the topic, find out what it means. Find out what it means in relationship to your values, your experience. Do searches that compare, for example, the treatment approach and your particular concerns. And look it up on YouTube and watch YouTube videos by other people that are dealing with similar issues, questions, or concerns, and how have they dealt with that. Learn about it as much as you can, and in that way you'll have as much knowledge as you possibly can, so that at least you go into the treatment with open eyes and you can pick up on any issues that might arise earlier than later. That way you're creating an optimal situation for safety and for considering the various options of treatment. I think by this way you'll have gained enough knowledge, and your experiential wisdom will teach you as you're dealing with these issues on an ongoing basis.